Havering and services available to residents. And this will result in one really long report and then also a condensed report kind of as an executive summary. So what we are doing is we're identifying the needs of the population. We're determining how well these current services meet those needs. And that includes NELFT, mental health services, that includes BHRUT, that includes the ICB Commission services, that includes the voluntary sector. And then we're prioritizing areas for improvement. So our aims are to understand the current and future mental health needs, and then also to develop recommendations to improve the experience and outcomes for Havering residents. So how are we doing this? Well, we have a working group that meets monthly from a wide variety of organizations throughout Havering, a very large project plan that I run, a lot of collaboration and a lot of communication. And so just to kind of clarify the scope for this, are common mental health conditions, for example, depression and anxiety, severe mental illness, for example, schizophrenia, bipolar disorder. It includes perinatal mental health. It includes the transition period from children to adult services within Havering. And it excludes dementia, learning disability, autism, and ADHD, as well as substance misuse and suicide. That just means that there will be either separate needs assessments done for these, or those needs assessments have already occurred. So just for capacity reasons, this is already going to be a very large report. So we're just making sure we do it justice by focusing in on those inclusions. Timeline-wise, we started back in September, and we are going to be done by the end of May, if all goes well and all goes according to plan. And these are some of the major contributors that I mentioned. So we have public health, NELFT, the ICB, BHRUT, primary care, other council departments like housing, supported housing. We have external agencies like the DWP and CGL. And then we also have the voluntary sector, like I mentioned. So just gonna really quickly whiz through, and then we hopefully will have a few minutes for questions. But basically the way we've done it is split it up into 8 different objectives. So the first objective is to give policy context. So we've done this chapter already, and this is national strategy, and then also Havering strategies related to mental health. We also then have a chapter on the prevalence, so that'll have the population and demographics, the prevalence of the common mental health disorders, severe mental illness, and perinatal mental health, and then also long-term projections, so trying to see how mental health prevalence will change over time. And prevalence is basically just kind of measuring how many residents throughout Havering have these listed. And then also we want to talk about the risks, causes, and impacts. So we have a chapter talking about how housing, income, education, employment, and social connectedness affect Havering population's mental health, and then also other risk and protective factors. So we know that there are many things that shape someone's mental health. So this chapter does its best to kind of summarize that and put that in a readable document. And we also outline the vulnerable groups in Havering. So these are these groups listed here, and this was through national evidence engagement with our working group. And so this is kind of, I think, where a lot of people who are in this network will come in making this section strong, because we want to make sure that it has as much Havering context as possible, because we know all the national evidence as public health professionals, but we want to know what is going on in Havering for these vulnerable groups, and also any data related to that. So that could be the number of people who identify as LGBTQIA+ as an example, or different programs for people with living with long-term conditions, that kind of thing, to really get that grasp and kind of show what's going on with mental health in these vulnerable groups in Havering. We also then have a chapter that lists all of the different services available to Havering residents, and then it also has all the data corresponding to that. So referral rates, outcomes. So this is kind of just a very long list, and there is just a lot happening throughout Havering in mental health. We're also running focus groups, so we'll be talking to staff who work with service users with severe mental illness. We'll be talking to service users with severe mental illness. We'll be talking to young people who have gone from children to adult services within Havering. And then we also are including existing qualitative evidence. So that could be we have talking therapies who have kindly given us some qualitative evidence. So that is that they ran focus groups with Black men within their services to see how they can be more inclusive and how they can improve the services. And that's just one example. There's so much, like I said, that goes on throughout Havering with that. I'm sure that some of the frontline staff here have seen that a survey actually went out 2 days ago for all frontline staff in Havering Council. And that is to scope kind of if frontline staff in Havering Council already do referrals to mental health services, if they want to be trained to, if they themselves feel their mental health and well-being is being taken care of and cared for. It is a comprehensive survey, and we've already had a lot of really good responses, and that'll be out until February 14th. So we're really excited about that, and we're getting really great feedback from those frontline staff, not only in mental health services, but also housing officers, council techs, just kind of anyone who engages frontline with residents face-to-face or via Teams, but frequently to kind of understand mental health from them as people who engage with residents. And then also we've done external stakeholder engagement, so kind of talking to frontline staff from the DWP, CGL, police, LAS, which is the London Ambulance Service, the fire brigade. So we're really trying to scope out mental health throughout the entire borough. And then the seventh chapter, the seventh objective is all about prevention. So how do we prevent people from reaching crisis? So this is kind of a more led by public health, where we're doing a literature review to try to find out what is out there on improving prevention of ED presentations in Havering. And then the last chapter, so with that working group that meets every month, with all of those meetings I mentioned with external stakeholders from all across the council, we're forming recommendations. And so that is in the immediate, medium term, and long term. And this kind of report, we hope, will go to people like commissioners who decide how to fill in those gaps in mental health. So that is kind of the goal of those recommendations, is to, after all of this information is gathered through all of these different chapters, to say, now what? How can we improve mental health within Havering? So I know that's a lot of information, and it's going to be a lot of information to be presented, but how can you get involved? Why am I here speaking to you? So, like I mentioned, we want to know everything in a Havering context light. And we would love for you to share data information or just, your perspectives related to those vulnerable groups I mentioned, or in mental health generally. Let us know what is going on in your organization to promote good mental health, and give feedback on what gaps there are and what challenges you witness, whether you're a frontline staff worker or you're working in adult social care. We're really just interested in hearing from you. So there's my email. I'll also pop it in the chat, and I think that was on time, Sophie. I hope that was on time. Yeah, so thank you.
Thanks so much. We've got a question in the chat from Liz, who's asking, when do you think your report will be published?
That's a good question. So right now it'll be done by the end of May. I'm not actually sure when it'll be published, hopefully in the summer. I'm not really positive the kind of timeline of that. But I can let Liz know when I find that out.
Please share it back with us, definitely, when it's done. And then Anna shared about wanting the slides, but I know you've sent those to me, so I thank you for that. I will send them out. John, did you want to come in? Sorry, I can see you're messaging in the chat. If you would like to speak, let me know. If not, please pop it in the chat.
Yeah, is that okay? Very quickly on mental health, Sophie, just to let people know, we had a great turnout at the Ardley Green Family Centre Hub last month. On the 4th of February, as part of the hub, we're partnering with a mental health organisation called The Mind of the Student to go into secondary schools. And we're working on a project which is really exciting, which we're calling The Mind of the Parent. And they're looking to sort of see how they can support parents we'll have students with mental health issues. So it's an open invite to hear the launch of the project. That's the 4th of February at 9:15 at the Hub. The Hub is going to carry on as normal with the professionals being there, but the representatives for the Mind of the Student will be launching this initiative, which links in, I think, with what Isabel is saying. It's almost strategic thinking, really, isn't it? Or is it chance? I don't know. Thank you.
Yeah, no, if you wanted to send a little couple of lines about that to me, then I can send it out to the group, or
Perfect. I'll do that straight after the
whatever's
meeting.
helpful.
Thank you.
But thank you. Any more questions for Isabel? Please just pop them in the chat. But no, that's really great. Thank you so much. Appreciate your time on that. I think we're moving swiftly on, if you don't mind, to keep to the agenda.
Sure. Thank you.
Thank you so much. On to Cheryl around the All Age Autism Service. Hi, Cheryl.
Hi everyone. I'm Cheryl Kearney. I'm actually the CEO of the Sycamore Trust. We are an autism charity that are based in Barking and Dagenham, Havering and Redbridge. So I'm coming today to talk to you about the All Age Service. I'm going to share some slides. I'm not very good at sharing, so please bear with me.
I'll let you know when they're up, Cheryl.
Thank you.
Oh, yep, there we go.
You can see them. Perfect.
Is it, are you able to just make it full screen for us at all?
Yeah, I'm just going to put it onto slideshow. Can you see it?
Perfect. That's great.
Perfect. So yes, I'm here today to talk to you about the Havering All Age Service. It was commissioned to start on the 1st of November. It's a wonderful service. We are supporting people from preschool age right the way through to adulthood that are Havering residents, and that's both pre and post diagnosis of autism. We're supporting the individuals and their families. It's the first time that we've had an all-age service. We used to have just an adult service that ran out of the Hub in Romford. Most people know the autism service in Havering that ran out of the Hub. So it's replaced that, and it's actually available to all age groups, which is amazing. The service has two distinct parts. So we have the family services, where we're supporting parents or carers of autistic children and adult children, and also our adult service, where we're directly supporting the adults themselves. It's not being run just from one place anymore. We're actually delivering out of the north and south of the borough, and we're also doing some stuff online, because we know from past experience that lots of parents are working, lots of people are working, and they want to come and access services either in the evenings as a group or get some one-to-one appointments. So we've tried to make the service as flexible as possible. So I'm going to talk about the family service. The family service is really busy, as you can imagine, and we do one-to-one appointments for families both in Rainham and Harold Hill. These two venues actually came out during a survey that was commissioned by the local authority about this time last year as the places that people most wanted to go to access support. And that's why we're in those venues. So parents can book, make an appointment, come and see a member of staff. They can get support with a wide range of things: behaviour, education, benefits, someone to just come and have a cry to. So, you know, it's a really worthwhile service. We also get people contacting us either by telephone or email that just want a little bit of support or want signposting to another service, and we provide the same service virtually as we do face to face. I will put all of the emails up at the end, and I will give Sophie this presentation so she can forward it on. The adult service, which is the other side, is where we're directly working with adults. Again, it's run out of Rainham and Harold Hill. Adults can book one-to-one appointments with our adult lead, and he can support them with a wide range of things: employment, benefits, finding social groups, whatever they might need. The nicest thing about the adult service is the group. So we used to run one group from the Romford Hub. We are now going to be running 3 peer groups over a 6-week period. We've still got our Romford group that runs, but we have a new group in Harold Hill and Rainham, and that's where adults with autism can come together, support each other, and start building a community and friendship. So it's a social group. the pre-diagnostic group, which I'm hoping that some people on this call can help with us today, is for those people that are sitting waiting for a diagnosis. And I think if you're not aware, it can take between potentially 3 to 5 years as an adult to get an autism diagnosis. So we are working with NELF to get the people sitting on their list waiting diagnosis. But if you have any residents that you're supporting that feel they may have autism or are waiting an autism diagnosis, then please send them over to us, because we can help and support them through that journey, and it can be really, really long. And some of the other things that we do, we can offer organisations and businesses within Havering some of our autism ambassador awareness sessions. I'm sure quite a few people on this school have met Robert, who is one of our autism ambassadors who has lived experience of autism, and him and his colleagues come along and talk about their own experience and talk about some of the real issues that people with autism can face when they're out in the community or when they're at work or school. So if you feel like you would benefit from having one of those sessions, they're generally an hour long, please drop me an email and we'd love to get you scheduled in. We're also running some free workshops under this contract for parent carers, and the topics really are based around what parent carer feedback is. We've recently run, I think, 2 sensory workshops for parents, which have been really, really well attended. All of the information is on our website. I've been told to say that by our marketing communications manager because I always forget. So please visit the Sycamore Trust website and you'll find everything on there. But I will send this presentation to Sophie. Thank you.
Thanks so much, Cheryl. We've got a question in the chat from Liz around, would you be able to provide the sessions internally and resident training?
Is that the autism awareness training?
Liz, did you want to ask your question?
Yeah, sorry, I'm in the office. I'm going to be talking low. Yeah, we put on free residence training. I don't know if there's something you could get involved with maybe, and also internally if staff would like it as well. I didn't know if that's something that would be available from yourselves.
Yep, so we can offer training. We're funded to deliver, I can't remember how many sessions a year, but Liz, please drop me an email. But I think the resident training would be really interesting because that's not something that we've actually done before. So yeah, I would really be interested to talk to you about both aspects, but yes, we definitely can.
Thank you. I'll pop you an email.
Thank you.
Thanks very much. Thank you.
Fab. And all slides and contact details will go out afterwards for all the presenters. Has anyone else got any other questions for Cheryl at all? If not, you're obviously welcome to contact her outside of this. But thanks so much, Cheryl. I know you have to go soon, but there may be a few more things in the chat.
Okay.
Andrew has a question, Cheryl, just in the chat about you may want to respond to in the chat if that's okay. And there's a few other folks that are going to reach out to you. Did you want to respond to Andrew's question? Sorry, before I move on.
If we've got time, if not, I'll
go for it.
Yeah. So yeah, I think
I'm just interested to know, Cheryl, just how it's going,
Andrew.
really.
Yeah, to be fair, because the hub was very well known as the autism hub in Havering, so there was a lot of concern about actually moving it to different places. It may not have been so well used, and actually it is being well used. The support groups that we get are well attended. People are booking one-to-one appointments. We've actually got our new peer group running at my place in Harold Hill today. So I think, yeah, it's actually working really, really well, which is great. And I know we are going to be reaching out to some other people in this call to come to some of the other hubs and deliver service from there. So yeah, I think changing mindset was a really, really good idea.
Thanks so much, Cheryl. Any other questions in the chat, please do have a little look, respond to those. Some people may be popping some extra bits in. Tareem, did you want to come in before you do your presenting next anyway, aren't you?
Oh, I am, aren't I? Okay, it's fine. I'll talk then. Sorry.
No. I mean, you're welcome to take the floor now. You can ask your question and then you can go ahead and present if you're ready.
Oh no, I was literally going to say what I'm going to say in the presentation question because I have to cut the call short. I've got another call at 1:30.
Oh,
Unfortunately,
sorry,
I'm
go
not
on.
as well prepared as the other two ladies. I don't have any
That's okay.
amazing slides to show you,
No,
but
that's
there is
okay.
some
Please go
content
for it.
which I can share later. I am on behalf of Supporting Humanity charity. We're born out of COVID. We're a mental health and bereavement support charity, as well as a funeral director service. And we're doing a lot of work across various areas. We predominantly work with Nell boroughs, but Havering has been a borough that we've worked in from the beginning, just because I think it's just the vicinity of it, it just makes it easily accessible for us. So there's different areas that we can potentially support or co-work or even collaborate with anyone that may be interested. The first one is we've got an emotional support line, which is manned by 3 cohorts of emotional support line helpers, and it's for anyone. So you don't have to be whatever mental health related problem you may be suffering, whether you're a parent or a child or a worker, you can contact us and just talk, and there'll be somebody there to listen. If we catch on to any kind of specific needs, we will signpost you, and we have got onboarded clinical psychologists and counselors that we can refer to, because obviously it avoids the bottleneck that you may face if you were being referred via other channels. So that's one thing, the emotional support line. You can follow us and kind of get more information on our services on our website, which is supportinghumanity.org, or our Instagram or LinkedIn, which is once again Supporting Humanity charity. So that's one thing. The other thing we do is we do a lot of trips and events for people over the age of 60. So you could promote the service or the events or the trips to anyone of your attendees or service users that are over the age of 60. And the purpose of them is to give them a day out. And we have our trips and our events are very like luxury and exclusive. We have a lot of sponsors and donors on board who support the cost of everything, which means that our attendees and service users don't actually end up paying that much. So for example, our next one is on the 18th of February in Saffron Kitchen. It's our annual luncheon, and this will be our first event of 2025. And the annual luncheon basically means that they can sign up to attend. They arrive at 10 a.m. It finishes at about 4 p.m. And it's going to be an afternoon full of hot, good food, 4-course meal, plus entertainment, plus raffles, and of incredible prizes that they get to take away. And obviously the raffles aren't going to cost them anything either. We give the raffles to each attendee for free. In addition to that, other than that, we've got and obviously I'll share the contact information and booking information for that with all of you, so you can share it with your service users. In addition to that, we've got another 5 trips planned for the remainder of the year. One of them is actually to Isle of Wight. Once again, the cost is very minimal because we take the cost on our heads via our sponsors and donors. And all the trips and all the services are for over 60s. There will be one which will be intergenerational. And the purpose of the trips is to give them an opportunity to get out, socialize, destigmatize mental health, and get them talking. And a lot of the activities that we're doing throughout our trips and events is engaging in conversation and getting them to speak, and potentially signposting them to services or users that we think might be, service providers that we think might be of benefit to them. So they come from all ages, all faiths, all demographics. And the other third and final service that we provide are well-being services. So we do monthly bereavement support circles. We are launching a monthly workshop for young girls. So from young girl into women, the kind of transition they would face, the mental health related issues that they might come across that may need addressing, that may not be addressed at home or at school, or environments that they may not be comfortable addressing them in. In addition to that, I ran a program last year called Making Menopause Magical, which was to destigmatize menopause and address mental health related issues that come with being menopausal. And, many of us don't know that there's 4 stages and it can start as young as 35 for some women. In addition to that, we also do Menopause Magical for men, so that the men are on board with the idea and understand how to deal with this when their women, their wife, their mums are going through that transition. Um, and that's just a couple of examples I'm giving you to the plethora of wellbeing services that we run weekly and monthly. All of our wellbeing services are completely free to attend. They are all facilitated by accredited and qualified people, and we are all DBS checked. Our organized is completely volunteer run, and yeah, so if there's anyone that would like to reach out to avail any of the services, or if you'd like for our reach out team to come to you, we've recently completed a reach out project with schools where we've gone and done mental health awareness and signposting workshops on 3 levels with the parents, with the staff, and with the children across all year groups. And everyone who avails our services, obviously, we kind of tailor make the event or service that we provide according to their needs and the area that they are trying to target or work on. So that's supporting humanity in a nutshell. We are also free of charge funeral directors, so we take and that's faith centric. So we're Muslim Muslim funeral directors, and we're completely free. So whenever if there's a death or somebody in palliative care or end of life, we take over. We do everything for them to take away the stress of losing a loved one, and obviously post that burial, we've got the bereavement support services and emotional line in place for them to reach out to us at their um, convenience. We are always there. We're open 365 days a year. So that's supporting humanity in a nutshell. If you feel like it aligns with anything that you're doing, or you'd like to, send any of your service users, or yourself would like to attend, please do. You're more than welcome. In addition to that, my side hustle or side role is I'm a TV presenter on Islam channel. So obviously it's a faith-centric channel, and a lot of our audience are Muslim or Southeast Asian demographic, but they're from across London. So, but we have a lot of viewership in Havering, Northeast London boroughs, etc., because that's the target market we've kind of captured in terms of audience. And I have a morning show on that. So it would be my pleasure to have any of you come on my morning show to promote and talk about any of your services, whether it's autism related projects, whether it's age related projects, whatever your projects may be, and you want to get traction and get that PR that's available for you via me. So please do reach out to me, and then I can put you in team with the producer, and you can come on to the show and talk about your services, because the show itself is not faith-based. It's kind of generic. We have a lot of guests from different backgrounds come talk about their services and their projects. But obviously, if your service users are in line with what our audience are, it might help you engage them on a different platform, because I do know that some demographic are a little bit hard to engage with when we're using the traditional means of communication with them. So that's us in a nutshell.
Thanks so much, Tareem. A lot in a very short space of time. You're doing a lot, so that's very cool. Does anybody have any questions? I don't know if there are anything in the chat. So I was just gonna have a quick look. Betty said she'd love for you to visit them at Rainham Food Bank, which would be very cool. Could you please share your email address in the chat? I will share it afterwards, but would you
Yes.
mind just please sharing it in the chat? And just, I will reach out to you just to check all your Joy services up to date, because you do so much. So I just want to make sure we capture it all. But I have linked in the chat for anyone who wants to see. There are links to all the supporting humanity stuff in there. So yeah, you can find and make referrals, signposting on there also. Sam, do you want to come in?
Hi, thanks, Sophie. Yeah, thanks for that presentation, Tareem. So I'll just introduce myself. So I am the engagement and community comms lead for the partnership in Havering. And one of the things that we do that's fundamental with our work is engage our local communities to inform us on priorities that we are looking to implement. So in regards to that, I guess PR sort of approach that you do have, it will be great if we could definitely continue conversations on what that looks like in terms of just recruiting voices to further inform the work that we're doing, if that makes sense.
Yeah, absolutely. And I think you've got a huge plethora of groups and people in that specific demographic that are now more confident and able in comparison to previous, generations who are really forthcoming with kind of engaging and changing the narrative, not just about what they represent, but also how they can contribute to the wider group of communities. So please, yeah, I'll put my email address in there. I'm sure Sophie will share it too. But do reach out to me. Tell me a little bit about your projects, initiatives, or whatever you'd like to support on. Obviously, the PR element of it has got nothing to do with supporting humanity. That's my like day job as a TV presenter. But if you would like to collaborate or co-work with any supporting humanity projects as well, we'd love to have you on those fronts as well, inshallah.
Thank you.
Okay, but like I know I was stepping in earlier, but that is because I have to actually now cut the call really short. I've got another call to jump onto, but I'm really sorry. And you're all doing incredible work. I've joined the previous call, so keep it up, and hopefully I look forward to speaking, collaborating, and working with all of you in the near future.
Thanks so much. I'll provide your email so people can reach out to you. Appreciate it.
Thank you so much, Sophie. All right, take care.
Cheers.
Bye-bye.
Bye. We're now going to move on to Georgina, who's going to introduce herself as her new role in infant feeding. Georgina, are you with us?
Hiya, hello. Good
Hello.
afternoon, everyone. Hello. Hiya. Should I just start by sharing the presentation?
Yeah,
I'll go
please
through
do.
that.
Go for it.
Okay. Just bear with me, please, people, because let's try and go. Yeah.
It's all good. I'll let you know when it's up.
Are you there? Is it there?
All looks good. If you could full
Yep.
screen, that would be fab. And then we're all done.
Just bear with me. Sorry, people. I'm a bit. It'll be fine. I'll try and full screen from there. Have you got it? Or
if you wouldn't mind, just in the bottom right, you might be able to go into sort of presentation mode. Next to where it does the zooming. If not, it's all good because I will share the slides afterwards.
I don't know. I don't think it's doing it. No.
It's okay.
Is that better?
Oh, that's it. That's perfect.
Yeah.
That's perfect.
Okay.
Go for it.
Perfect. Okay. Hello, everyone. My name's Georgina. So I'm just here really to introduce myself and to discuss what I'm going to be doing for Havering. So, just an introduction into my role. I'm the new infant feeding coordinator. This photo here is me working alongside the maternity unit at Queen's Hospital, and with the voluntary services that are known as Latch On. So you can see the ladies there in the green t-shirts. So they're a charity funded breastfeeding support group that are in Havering. So this photo is me with some of the midwives there that had babies, and we'd given support to them for breastfeeding. So just going to go on to the next page. So yeah, so my name's Georgina. I joined here Havering in October. So I am based within the early help service. Purpose of me joining this call is just to say hello to everyone, just so that you can see my face, so that I can put myself out there a little bit, and just to start working collaboratively with colleagues to ensure that women, children, families receive guidance and support with regards to infant feeding. So background, level 3 qualification in children and young people's workforce, a level 3 qualification in healthcare. Last employment was a lactation consultant at Queen's Hospital. I've got experience of working across maternity, both antenatal, postnatal services. And in April last year, I did complete my lactation course, which it's a little bit more in depth in the anatomy and physiology of breastfeeding. So just to enable me to submit to deliver training and support staff and women. And for that, I would like to thank my dog, who you can see in the photo. So she was there to just be by my side through that. Yeah, some of it was quite mundane, but we got there in the end. So yeah, that's that little bit of that. So the UNICEF accreditation program was introduced in the UK in 1994. So the baby friendly accreditation program is recognised and is recommended in numerous government and policy documents across all of the UK, all 4 UK nations. So this is including the Institutes of Health and Care Excellence Guidance, and the programme supports maternity, neonatal, community and hospital-based children's services to transform their care, and work with universities to ensure that newly qualified midwives, health visitors and all staff working on the front line with women really are there, have a strong foundation of knowledge that they need to support families. So services with implemented baby friendly standards, but they will receive an award, so a nationally recognised mark of quality of care. So my role is these are my objectives. So to achieve the Children's Centre UNICEF Baby Friendly Accreditation, level 1 and 2. I have put a link there, so these slides can be shared, and if people want to read a little bit more about the UNICEF baby friendly guide, they can go on to that. I've given you a little bit of an insight, but we'll be here a long time if I do much more. Okay, so it's just so that we can, so Baby Friendly Initiative enables public services to better support families with feeding and developing close and loving relationships, so that all babies and all babies get the best possible start in life. Okay, so I will be developing a breastfeeding peer support program. I'm hoping to co-produce and deliver antenatal education and breastfeeding workshops, hoping to develop a infant feeding policy for Havering. We are going to be developing a training program for staff in the early help service, so they'll all be trained to a level 3 standard, and then I'll be carrying out audits and providing evidence of those. So I'll be working co-producing collaboratively with partnerships, so already working alongside the maternity unit, health visiting and the voluntary sector. Next one. So this is what we have at the moment in Havering. So at Havering at the moment, every Wednesday 1:30 till 3, there is a infant feeding cafe. That is based at St Kilda's. It's a welcoming environment, an opportunity for women to attend, whether they are breastfeeding, bottle feeding, the supports there available. If babies are introduction to solids, so babies that are starting to eat food, coming away from feeding, if they were exclusively breastfeeding. So this group provides that support. It's a walk-in session. You don't need to have an appointment, so women can come, just if they feel like they want to. Telephone and email support is available. Also, I'm kind of juggling that at the moment because as my workload increases, I'm not sure that will be maintained, but at the moment we can provide telephone support and email support. Referrals can be made directly by the user or by outside agencies via the Children's Centre email that I've put there. And that's just my contact information, so just my email there and telephone number if anybody does want to give me a call and have a chat. If you've got any recommendations, any ideas, anybody wants me to come out. I know we're going out to the mother and baby unit next week just to introduce the services to women there. If anyone wants to contact me, any ideas, just give me a shout. That's it. Thank you. Thanks for listening, everyone.
Thanks so much. Does anybody have any connections for Georgina or any ideas of how you could work together, questions, anything you guys want to share? If not, I'll share the contact details afterwards so you can get in touch.
Thank you.
Fabulous. I will leave you guys to connect with Georgina in the chat and offline. Can you refer via Joy to the support? In terms of the current support offer, Georgina, latch on the signpostings on Joy. I was wondering, the other stuff, the cafes, is it just drop in, or how would you refer? Or you're just on mute, sorry. I'm trying to see if I can unmute you. I don't think I can.
Right, I've lost you for a minute then. Are you there? Sorry, I'm in the back room in the office and the internet's not great out here. Sorry, what did you say?
In terms of how would people refer into you? Is it sort of drop in, like the support?
So the infant feeding cafe is run by myself and level 3 BFI trained level 3 staff. So that group is open for mums. It's advertised via the maternity units. I think also on the Havering directory we've got information on there with regards to that, and I believe it's going to be shown. There will be advertising on Facebook as well. I know the Joy app, but I think at the moment have you got Latchon's details on there?
Yeah, I was going to say, I'm going to reach out to you to get the cafe
so
on there?
we're in the process with comms at the moment to produce a new poster with some updated information. So that's why we haven't got anything in place at the moment. But any people can, you know, if women, I can contact women directly if they've got a specific issue and, you know, they're not able to come into the cafe. There are other methods of support that we can provide. So either reach out to me or the Children's Centre email that's on there.
Amazing. Cool. Any other questions for Georgina at all while we've got her? Cool.
Perfect. Thank you.
Thanks for that. I think you've shared your slides with me already, haven't you? So I'll send those out. Fab. Next up, we've got the orange line. So I think we've got Jan and Karen from St Francis Hospice, if you guys are with us. Hello, Karen, I can see you. Sorry, you're just on mute, by the way.
Hello, thank you. I think it's just me doing the talking, if that's okay.
Fabulous. Yeah, of course.
Gosh, lots and lots of information for some incredible support services. Thank you all so much. If I may, I'm just going to slow myself down a little bit because sitting here listening to all your fabulous service, I can feel my neck's going red. So I've pulled my scarf up a little bit. So I'm just going to slow it down a little bit, if I may. As you've kindly mentioned, my name is Karen Freeman and I'm the project manager for an incredible team called the Orange Line. I am employed by the amazing charity who's just been graded outstanding by CQC again, St Francis Hospice, who's been part of this community for the last 40, we're in our 41st year. So therefore, I hope you feel that you can trust us. We are trained, supported and governed by all things at St Francis Hospice. So we would have formed part of that CQC inspection. So I just wanted to give you a little bit of information about our history. And this team started in 2016. We're not a clinical team. We recognise, our clinicians recognise that a telephone help support line for people who were not necessarily in need of medical help may be really useful for the people in Havering, Barking, Dagenham, Redbridge, Brentwood that the hospice supports. And we were going to focus it on people who are lonely, isolated and bereaved. We felt that that was an area that we already knew a lot about, and with some additional training we might be able to help support people who had no hospice connection or had hospice connection. So the Orange Line team can support anybody in your in this community, whether they have a hospice connection or not. We didn't really know what the team was going to look like. We didn't really know who we were going to be supporting or how the service would evolve. We knew that the real truly lonely and isolated people were not going to pick up a telephone support line and phone in, and that's where we're going to ask you amazing people. You guys are going to be working with lonely, isolated people that may benefit from some of our telephone and group support. We learned that many people have a tricky emotional time when they lose something. That could be a bereavement. They could have lost someone close to them. But we also started to support people that had retired, people whose families had moved away and suddenly found them left on their own. People who had to give up driving, they'd lost that mobility, so they'd lost their contact. So all of these losses started to come in to our phone lines. So we realised that actually it's not just bereavement that leads people to feel lost, lonely and isolated. People come from every walk of life. I don't need to tell this group of people this. So the real essence of the service became clearer with time. We became a bit of a lifeline and provided the opportunity for people to be heard. We run a telephone help support line. Sometimes people just phone in once. They'll have a rant, but they feel that they've been heard. We don't want to provide lots of different services to lots of different people. We know that we can't do everything properly. So we have streamlined our services and we offer temporary support to people whilst they're going through a tricky emotional time. So we're not with them forever. We don't support people forever. We just walk alongside them whilst they need that additional support. So we identified for bereaved people, their lives had completely stopped still. So I'm going to try and share this screen with you. So we set up, can you see that?
Yeah, it looks good.
Yeah, we set up some local support groups called Friendly Faces. So we meet in local cafes. The main one in Romford, we hold in the cafe opposite the town hall, Romford Baptist Church. They've got a nice cafe in there. I've seen some of you in there previously before. We responded to the fact that people who were lonely, isolated and grieving really benefited from being with others. As you see on this orange heart here, we say it often helps to normalise the emotions and behaviours triggered by grief by connecting with others. We really wanted to connect people. So we responded to that. These are not counselling sessions. We just provide the opportunity for people who are grieving to come together and start to work out how they navigate their grief with the support group of people who really do get how they're feeling, and they realise that they're not alone. So to date, we've started up approximately 15 groups for bereaved people across the 3 boroughs that the hospice cares for. The groups are made up of between 6 to 20 people. They're small groups. They're facilitated by Orange Line volunteers who just bring people together, and we call these groups Friendly Faces. The second thing that we learned very quickly is that the emotional toll of a health scare was huge on people. Obviously, the hospice does support people with all life-limiting conditions. So that's whether that's motor neurone disease, multiple sclerosis, kidney, heart failure, of course, cancer as well. And cancer seemed to be the one big, scary word that freaked people out when they got that diagnosis. So we decided that we would try and support those people as best we could, and we actually recognised that there was a lack of cancer support from the Brentwood side of the borough. So we do have lots of Havering people coming to our cancer support group. And we call that Tea and Talk at Toby's. It's very scientifically named because it's held at the Toby Carvery in Brentwood. And that's a monthly support group. And that's actually supported by one of the cancer champions from mid and South Essex, but it's available to anybody from any area to come along. Back end of last year, we had representatives from NHS England and Macmillan Education nationwide to come along to this support groups to try and understand why it was successful. And they spoke to the professionals that came along, they spoke to the attendees that came along, and the one word really that fitted all of them is that just connecting with others who really do get all of the groups that you set up. You're connecting like-minded people. The power and the strength that people take from that is easy to see. But they were really impressed, and they're going to try a pilot in Harlow based on our cancer support model, our Tea and Talk model. And if the pilot goes well, they're talking about setting up a national chain of cancer support groups in conjunction with the Toby Carvery. So I recognise that you will all probably be thinking of people who may be lonely, isolated, bereaved that you're currently supporting. And hopefully if you're writing down a list of people that you can tell about the Orange Line team, the phone number is on all of our paperwork. It's one phone number. And if you remember nothing from today, please make sure you take down the number, because if you're not sure, you can call it. But I'd also like to invite you to think about, what does loss mean to you personally? We're all such rocks for so many other people in our lives, for the people that we support. What happens when we have that emotional wobble? People like me and you, we have our own personal lives. We all experience loss in some shape or form. Who listens to you? We're currently supporting a local district nurse. We've had a phone call from a theatre nurse who called us in immediately after surgery because the anaesthetist broke down after losing her brother. And I'd just like to read a message to you from a local palliative care nurse who called us in, and she sent me a really lovely email. So if you don't mind, I'd like to read it too. She said, "I'd just like to say that I've had a call from Rosemary from the Orange Line. I ran into a private office, had a chat, had a meltdown. I have to say, she was absolutely lovely. She was so kind, just what I needed. I just wanted to recognise to you the value of the service and how even as a specialist, even in palliative care, it was so welcoming just to talk about how I was feeling with someone that we didn't know outside of my work and outside of my family." So from 2016, we've made, we started from a base of 0. There was two equivalent paid staff. We've now got those 2 equivalent paid staff, but we now have 24 volunteers helping to deliver this incredible service from all walks of life, all trained and supported, and under the umbrella of St Francis Hospice. So we'll make about 3,000 phone calls this year. So the phone calls and the groups, new groups we'll be setting up, will support a few hundred people this year. We do run social groups for individuals that are under the care of the hospice, but all of our services can be accessed, as I've said earlier, by anybody who lives in Havering, Barking-Dagenham and Redbridge. I hope that you will feel that you can trust us and you can rely on us. We're not a medical team, and we all come from corporate industries where customer service is really important. So we don't have waiting lists. We don't have lists for people to go on, and we get to them when we can. We've all got customer service background. Everybody who phones in is treated really, really importantly, and it's important to us that we resolve and help support them temporarily whilst they need someone to walk alongside them. So basically our focus is to allow people to tell their story, to allow them to be heard so that they can find the emotional strength and resilience to get back to their normal life. People who whose mental health has been affected by a loss in their life, absolutely, please refer them to us. We can help them. For people for whom there is an underlying mental health condition where they may have mental health experts already known to them, they may be on condition, we probably wouldn't be the best service for that. But I've already heard this morning there are some incredible mental health services out there. So for people for whom their mental health has been temporarily affected by something big going on in their life, please do give them our number. That's it. Thank you.
Thanks so much, Karen. I know that everyone is probably really blown away by your presentation, has tons of questions. I do want to come for the questions, but I'm just conscious we have another agenda item and I'm conscious of running out of time. We've got Councillor Ford and then Lisa. Can I ask you to keep it as quick as possible? I'm sorry.
Thank you. Are you looking at providing this service actually within Havering, as Brentwood is a little bit too far for some of our residents? Thank you.
Oh, can you still hear me?
Yep, all good.
Yes, you can. We had a brief discussion with the Toby Carvery in Romford, and also the Moby Dick as well. We do know that there is a cancer support group run by Queen's Hospital that comes out of the Moby Dick, so we didn't want to tread on their toes, so we pulled back. And then COVID came in, and obviously all discussions stopped. I haven't picked up with the Toby Carvery. The brand is called Tea and Talk at Toby's, so we kind of would like to stick with the Toby Carvery. And if it is felt that there is a need for another cancer support group, there's so much good stuff going on in Queens and the west side of the Havering area. We tend to pick up people that come in from Upminster and from Hornchurch as well, that come in if they can't access or don't wish to access the Queens. But it's certainly a conversation that I'd be very happy to have if there was a need for it. Absolutely.
Amazing. Lisa.
I'll get my microphone sorted in a minute. Hiya, Karen.
Hi, Lisa.
Firstly, congratulations on the CQC results. I think probably we all want to say that to you. I think it's really well deserved. And I just want to say that I've lost count of the amount of people that I've referred to Tea and Talk at Toby's, because I make the cancer calls, to the Friendly Faces group, which is fantastic because it's the only face-to-face bereavement support group that we have. And also to your just general support line. And I was going to also highlight that I think another reason that people really find it quite useful is because a lot of the elderly residents live with pets, and there's no specific bereavement support service for if you lose a pet, and yet that pet could be so very important to you. And so I always make sure that I tell them about Orange Line so that they at least have somewhere to go and to share those feelings with. But I won't talk for too much longer because I'll have Sophie chasing me and telling me off, and I don't want that. So congratulations on the CQC results, and yeah, I will keep referring people to Orange Line as I always do.
Thank you so much.
Amazing. Thanks, guys. The folks that are presenting on the IRIS domestic abuse programme, I'm so sorry that we are short on time. Is 4 minutes okay, or would you prefer to present at the next one?
I am a bit of a talker. I'm not going to lie. Unless Prateep, you think you can do it. I personally, I know because Prateep is being a doctor in clinic can be sometimes difficult in changing. I don't know where he is on the screen. Prateep, where are you?
Hey,
What's your
Colette.
thoughts on it?
I am here. Yeah, would it be possible, Sophie, if we could do it at the next
Of course,
meeting?
I'm
'Cause I think 4
sorry
minutes
about
might
this.
be- No, that's okay.
And
That's all right. No problem at
yeah,
all.
and actually, it would be great if we could be, if it's okay that I can be included, because I wasn't able to jump on for the whole meeting. But from what I've heard, there's a lot of services that will actually benefit our clients that we're working with.
Definitely.
That would be amazing.
I'll reach out to you just to check the time, but sorry about that.
That's okay.
But this, it's been packed with so many amazing services today. So thank you guys so much for your time. Please do continue to connect offline. I'll send you the contact details, send you the posters, all that good stuff. Our agenda is booked and busy now through to April, which is amazing. But if you do want to present, please let me know, because I can keep booking people in, obviously April and beyond. So if you are foreseeing that you are launching something April and beyond, please book it in now, because they've got loads of people that want to speak, and obviously we're only doing this once a month. I'm cleansing the distribution list because I don't want to spam people. Sorry if I have spammed you of any of my communications. Could you check that you're receiving the invites from May onwards? I've put them in as a recurrence to make it easier. If you're not receiving those, please email me. Anyway, appreciate your time as always. I hope these are helpful. I'll send you the deets. Please message me if you need any help with anything, support, etc. Anyway, have a good day, guys. Bye.
Thanks, Sophie.
Bye.
Thanks, Sophie.
Thank you all.
Bye.
Bye.
Thank you.
Thank you. Thank you. Bye.
Bye-bye.